Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we'll be discussing a medication known as morphine. Its brand name is Kadian. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me out with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how morphine works. We'll discuss indications or reasons we would prescribe morphine to a patient, then contraindications or reasons we would not be able to prescribe morphine, followed by examples of dosing, and then stick around till the end where we'll talk about side effects with percentages. So how does morphine work? Well, first of all, morphine is a pure opioid agonist, and it is selective for the mu opioid receptor. So in terms of indications or reasons we would prescribe morphine to a patient, we typically see this medication used in chronic severe pain in patients requiring long-term, daily, around-the-clock opioid therapy, and it's also seen in moderate to severe pain that is not responsive to non-narcotic analgesics. Now for contraindications or reasons we would not be able to prescribe morphine, so the first would be if a patient had a hypersensitivity to morphine or an allergy, or any other component of the formulation. It also would not be able to be used within 14 days of a monoamine oxidase inhibitor. It would be contraindicated in patients who have significant respiratory depression. Patients with a gastrointestinal obstruction, whether known or suspected, would not be able to use this medication. And also be contraindicated in acute or severe bronchial asthma in an unmonitored setting that typically wouldn't have the required resuscitative equipment available. Now for dosing with morphine, so the first thing that we have to note here is that you have to take into account prior analgesic treatment experience and risk factors for addiction, abuse, and misuse. We want to try to use the lowest effective dose for the shortest duration possible. If somebody is using the immediate release formulation, they may use 15 to 30 milligrams every 4 hours as needed, and then they could adjust the dose based on pain and adverse effects. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using morphine or Kadian, so I'll go over some of those here now. So about 6% of patients may experience dizziness, while 2 to 10% may experience a headache. Somnolence comes in at 3%, and pruritus or itchiness may happen up to 80% of the time. Constipation may happen in 9% of patients or more, and nausea comes in between 7 and 10%. More than 10% of patients may experience vomiting, and urinary retention may happen less than 5% of the time. Lightheadedness is also a possibility. Now, some more serious but more rare side effects would be orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, dyspnea, or difficulty breathing, as well as respiratory depression. That's all we're going to talk about today with morphine or Kadian. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.